RFK Junior is currently the head of HHS. Right now, there's a measles outbreak that started in Texas and has spread to multiple states that has infected over 700 people, mostly children. There's been 76 hospitalizations. There's been 2 confirmed deaths in children ages 6 and 8 years old. There's been 1 adult death, although that's still under investigation. The kids who died were unvaccinated. The vast majority of people being infected and hospitalized are unvaccinated. During RFK Junior's Senate confirmation, he committed to not discouraging the use of MMR vaccine.
Measles vaccine, I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those vaccines.
MMR vaccination is the key aspect of stopping any outbreak. And in fact, had the population been adequately vaccinated in the first place, this outbreak would not have occurred, those hospitalizations would not have occurred, and those kids would not have died. The question I want to answer in this video is, has RFK Jr. lived up to his commitment not to discourage the use of MMR vaccine? To be fair, RFK Jr. has made some statements that do not discourage the use of vaccines. They're not full-throated support, but they do not discourage the use of vaccines. For example, he said that all parents should consult with their healthcare providers to understand the options to get the MMR vaccine. And he said something to the effect that MMR vaccine can stop the spread of measles. But the occasional statements that RFK Jr. has made that don't discourage vaccination are completely overwhelmed by a body of rhetoric that is inaccurate and irresponsible and clearly discourages the use of vaccination at minimum. Here are 8 ways that RFK Jr. has failed to live up to his commitment not to discourage the use of MMR vaccine. Number 1, misleading statements about the MMR vaccine's effectiveness.
The vaccine wanes about 4.5% per year. So that means older people are essentially unvaccinated. Their immune system is not protected.
This is false and it's misleading. There was a computer modeling study from the London School of Hygiene and Tropical Medicine in 2024 that suggested a slight waning of immunity. But the authors themselves in that study say this: our results suggest a slight waning of immunity from the MMR vaccine over time, but the MMR vaccine remains highly effective, and receiving 2 doses will protect you and those around you against measles infection. RFK Jr. is discouraging the use of vaccination by suggesting the vaccination does not work. Number 2, false statements about the reasons people are being hospitalized during this epidemic. During this measles outbreak, RFK Jr. has said, quote, people are being hospitalized mainly for quarantine, end quote. That is false. People are being hospitalized because they're ill. These children, primarily, that are being hospitalized need respiratory support. They're dehydrated, they need oxygen, and at times ICU care. Saying people are being hospitalized for quarantine is factually inaccurate, but it also serves another purpose. He is not acknowledging that measles is causing disease severe enough to warrant people being admitted to the hospital. He is minimizing the severity of the disease, and by doing so, he is discouraging people from using the vaccine, because after all, if the disease isn't serious, why get vaccinated against it? Number 3, false and misleading statements about the role of general health and nutrition in the context of infectious disease.
It's very, very hard to kill a healthy child with any infectious disease, but particularly with measles. Very difficult for measles to kill a healthy person. So if you're healthy, well-nourished, in fact.
Of course, good nutrition and exercise and general good health is important. There is no doctor that would dispute that. But the way that RFK Jr. talks about it is a distortion, it's an exaggeration, and it's fundamentally misleading. He said in reference to this specific outbreak, quote, that we see a correlation between people who get hurt by measles and people who don't have good nutrition or don't have a good exercise regimen, end quote. And he said that the area where this outbreak started in West Texas is, quote, a kind of food desert, end quote. And he says that malnutrition, quote, may have been an issue, end quote, for the first child that died of measles in that area. First of all, there is zero evidence to suggest that the kids in those communities that died and have been getting sick are malnourished or unhealthy. In fact, the evidence is to the contrary. A local physician who works with the Mennonite community there says that they have excellent nutrition and excellent exercise. He says that they grow their own livestock, make their own bread, raise their own food, that the kids are very active on the farm. He says, quote, "They're the healthiest people out here," end quote. And he said also that, begin quote, "nutritionally, I would put them up against anybody." Texas public health officials have confirmed that the kids who died had no underlying conditions. For RFK Jr. to say that these kids got sick and died because they're unhealthy or malnourished is just, it's shameful to say it without any evidence. And it's just fundamentally inaccurate and misleading. It undermines people getting a vaccine. It undermines and discourages the use of vaccine because, hey, if you're healthy and you exercise and you're well nourished, you don't have to worry. Number 4, false and misleading statements about vitamin A. RFK Jr. is now and has always encouraged the use of vitamin A as a treatment for measles, if not a miracle cure or something that would wipe it off the face of the earth.
The World Health Organization now says vitamin A is an absolute cure for measles, which we didn't know about back then.
This is absolutely false. The WHO has never said that vitamin A is a cure for measles. RFK Jr. has said, quote, "If people were sufficiently nourished, especially with vitamin A, measles would not exist," end quote. This is a typical feature of RFK Jr.'s rhetoric. He takes a kernel of truth. There is a role for vitamin A in the treatment of measles. And he distorts it to such a degree that it becomes just fundamentally inaccurate and misleading, and again, irresponsible to say. It has been shown in low-income countries that have high incidence of low vitamin A levels that treating kids with vitamin A can help prevent bad outcomes. And this is less well established in high-income countries where the incidence of low vitamin A levels is very rare. But there's still some indication that it should be used, and doctors do use vitamin A in the treatment of measles. That is entirely different from saying that vitamin A is a miracle cure and that you will be completely cured from measles by using it, or that if people had adequate vitamin A levels, they would never have measles, or measles would somehow be eradicated from the face of the earth. This is just ridiculous. There's zero reason to believe, and there's no evidence to suggest, that the kids who were getting hospitalized and the kids who died had low vitamin A levels. He is again discouraging the use of vaccination. If you can get a miracle cure with vitamin A, why would you get vaccinated? Number 5, falsely suggesting that there are medications that cure measles.
They have treated most of the patients, actually, over 108 patients in the last 48 hours, and they're getting very, very good results. They report from budesonide, which is a steroid. It's a 30-year-old steroid, and clarithromycin, and also cod liver oil, which has high concentrations of vitamin A and vitamin D.
He has said elsewhere that kids treated with these medications have had, quote, almost miraculous and instantaneous recoveries, end quote. The thing to keep in mind about these claims is that these medications have absolutely zero track record in the treatment of measles. There is no public health agency in the world, including our own, that recommends these medications in the treatment of measles. There is no studies that have been done that suggest that these medications work in the treatment of measles. What RFK Jr. has is anecdotal evidence. It is true that measles can be very serious for children and cause serious illness and death. But it's also true that the majority of kids recover and get better. There is no way to know in this kind of situation whether the kids that got better because of the medications that were given or because they got better anyway. There's no way to know that unless a study is done. But that has never stopped RFK Jr. He is more than happy to elevate anecdotal stories to the level of factual evidence. And he uses the authority of his position to suggest that these medications can cure measles. If there are miracle cures, medications that result in miraculous and instantaneous recovery, then you don't need to get vaccinated. That's the implication. Number 6, he elevates and lionizes doctors that reject vaccines. This photo is from a post that RFK Jr. made to social media. He is pictured here with 3 families and 2 doctors. The families all had children who either died or suffered terribly from measles, all of whom were unvaccinated. One had a 2-year-old daughter who's in the ICU, according to RFK Jr., for 3 weeks, and the other 2 had children who died. Also pictured here are 2 doctors, and RFK Jr. says this of them. He says, quote, "I also visited with these 2 extraordinary healers, Dr. Richard Barlett and Dr. Ben Edwards, who have treated and healed some 300 measles-stricken Mennonite children using aerosolized budesonide and clarithromycin." By elevating these physicians, RFK Jr. is ignoring the 99% of experts, scientists, and doctors who would fundamentally reject the anti-vaccine position taken by these doctors. Why doesn't RFK Jr. talk to other doctors in the community? Why does he elevate these people? Why doesn't he talk to the doctors that are actually taking care of the kids that are in the hospital and see what their opinion is? Why doesn't he call them true healers? By focusing on these doctors, he's creating the impression that the doctors who are right, the doctors who have the best knowledge, the doctors that are, quote, true healers, are the ones that reject vaccines. By doing that, he is discouraging the use of vaccines. Number 7, creating the impression that the measles vaccination is as dangerous as the disease itself.
There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves.
This is dramatically false and misleading. According to the Infectious Disease Society of America and other sources, there's between 0 deaths from vaccination with MMR vaccine per year or possibly 1. And that is from anaphylaxis, if it occurs at all. Anaphylaxis can happen to any food, medicine, product, etc. A 1 in a million chance is minuscule. According to the National Weather Service, there's a 1 in a million chance of being struck by lightning in any given year for any given individual. The chance is minuscule. Compare that now to the chance of dying from measles. In a first world country, your chance of dying from measles is between 1 in 1,000 and 3 in 1,000. That means for every 1,000 kids that get measles, between 1 and 3 are going to die. And this is typical distortion and misrepresentation by RFK Jr. There's been no reported cases of blindness at all, so that's just an outright falsehood. With regard to encephalitis, the chance of getting encephalitis for someone with measles, for a kid with measles, is 1 in 1,000. The chance of getting encephalitis from the vaccination, again, is on the order of 1 in a million, the chance of being struck by lightning. By creating the impression that vaccination is as dangerous and creates all the diseases that measles does, it is clearly discouraging the use of vaccination. Number 8, he suggests that people should be infected with measles because ultimately it's good for their long-term health.
There are lots and lots of studies out there now that show that kids who get measles as a child are much healthier when they grow up.
Fox News, RFK Jr. said, quote, "There's lots of studies out there that show you if you actually do get the wild infection, you're protected later, and that it boosts your immune system later in life against cancers and ectopic disease and cardiac disease, etc." End quote. This is false and it's misleading. It's in fact the opposite. There's been multiple studies that have demonstrated there's an immune suppression that occurs during measles infection and after measles infection that can last months to years and make you more susceptible to disease, not less susceptible to disease. There's zero evidence that it reduces cancer and heart disease. This is just false and misleading. It's important to remember that these ideas have impacts. They have real world consequences. When people in authority, when people with large platforms like RFK Jr., now the head of the most important health agency in the world, say things like this, people listen. In fact, this particular belief that somehow measles is beneficial directly impacted one of the families whose children died in this outbreak. Take a listen to this basically heartbreaking interview where this family, a Mennonite family who apparently speaks some variant of German and have a interpreter. And this interview was, by the way, conducted by Children's Health Defense, which is the organization that RFK Junior started, which is arguably the world's largest and most influential anti-vaccine advocacy group. Anyway, they're getting interviewed and listen to how they've believed this false idea that has been said in the anti-vaccine community in general and by RFK Jr. in particular for years.
Let's listen. Doctors what they hold can.
She says they would still say don't do the shots. There's doctors that can help with measles. They're not as bad as they're making it out to be.
And also the measles are good for the body, for the people, because the measles are getting the what is it?
What
Entzündung. Infection.
Infection.
Yeah, they get an infection out and...
Do you mind this immune system?
Yes, immune system.
They're trying to say that the measles actually helps build the immune system in the long run if they get the measles now.
Nej, krigen är inte så lik kriv in the long run.
In the long run, they kriegen nicht so leicht, they kriegen nicht so leicht kriv.
Ja, nicht so leicht kriv.
Okay, so in the long run, he says they wouldn't get cancer as easily. It fights off a lot of stuff, the immunity that they get from the
I hope I've demonstrated in this video that RFK Jr. has in no way lived up to his commitment to not discourage the use of vaccination. He clearly is discouraging the use of vaccination. This is no surprise. He has spent the last couple of decades, spreading false, misleading, and irresponsible information about vaccination. This outbreak would never have occurred had the population been adequately vaccinated. These pediatric hospitalizations and deaths would not have occurred. RFK Jr. is discouraging the use of the most important tool that we have to stop this outbreak. The fact that this outbreak is occurring, the fact that people do not get vaccinated because of fears of vaccination, the decision they're making not to vaccinate their kid is in large part because of information they hear from the anti-vaccine community and from RFK Jr. in particular. RFK Jr. and the anti-vaccine community in general bear at least a portion of responsibility for this outbreak, for the kids getting hospitalized, and for the kids that are dying. Just like he always has, RFK Jr. is discouraging the use of the MMR vaccine, and he is an abject failure as the leader of HHS. He is failing to perform even the basic minimum duty that he is obligated to perform.